Liz Whitworth has been working with us here at CareOregon for almost 3 years now, helping us to onboard and develop and create the PreManage for us, and working across the state with groups and partners to really maximize our ability to use that tool. And I've had the privilege of working with Liz since the beginning because we were starting our transitional care program at the same time Liz came in to look at developing PreManage, and we used the transition program as the pilot to help develop what has now become a very robust utilization of PreManage for us. So
great.
Thanks.
Thank you, Jane. I'm on here, I think, live. Thanks, Jane. Hi, everyone. Sorry, I'm getting late to this because we're very busy, as Jane said, using PreManage in lots of ways. So I'm kind of the bookend, I guess, of this, or just about the end of this session. But just to kind of level set, because we're talking now, I think you've been talking about the actual work and transitions of care. My piece is a little bit more about how a piece of technology can help that work or enable it and help you all communicate, hopefully better is the hope. So there's some new terminology to introduce. So just by show of hands, how many of you know or have heard the term Eddy? Okay, good, yay. And how many of you actually use Eddy?
Fine use.
You actually receive the notifications either integrated into your EHR or a print version, or you actually log into the Eddy portal. Okay, so a few of you must be in the hospital setting, or okay, perfect. How many of you know what PreManage is? Yay, good. And how many of you actually use it, log into it, have an account? Okay, oh good. So this then won't be all new information. But I think it's kind of helpful just to level set everybody. So real quickly, what are Eddy and Pre Managed? Because believe me, people get very confused out there in what these two different things are, and they're really pretty much the same thing in some ways. But the what is, these are software products, really at their core, that are delivered either via your EMR or a web-based kind of platform that provide ED and inpatient hospital event data, plus limited clinical information, and very limited clinical information. It's not a full-blown EHR. And soon to come will be the Sniff event data, and we'll talk about that in a minute. These two platforms are developed by CMT, Collective Medical Technologies in Salt Lake City, Utah. So that's where they're kind of developed and housed. And the how is that these two products really work in tandem across the care continuum. So Eddy stands for Emergency Department Information Exchange. It really is the platform that connects hospitals to hospitals via a centralized database of ADT feeds, which are admission, discharge, and transfer records that originate in the hospital setting and get sent to CMT, the vendor in Salt Lake City, and put in a very large database and connects all this information so that hospital users who are Eddy users, so those again are the users, are ED docs and other hospital-based providers use Eddy, they can see information about patients as they're seeking care in the hospital setting. PreManage then is really basically a companion product to Eddy, so it provides users with access into this database of hospital utilization information to other players in the care continuum, CCOs, health plans, clinics, Sniffs, behavioral health clinics, and on through the care continuum. And these users then tend to be care coordinators, case managers, data teams, and others. And really the reason why that these tools were developed was for ED and inpatient utilization management, and then really care coordination around patient transfers of care, with really some interesting options to focus on high-risk patients. So, any questions about the what? So this is the vendor's logo and some of their branding. So if you've seen some of these things lying around, this is the Eddy Pre Managed folks in Salt Lake City. So these are some of their slides, but just to give you a sense of the breadth of their tools. So they now cover 25 million lives in their entire platform. They have over 200 hospitals reporting into Eddy. That includes, this is their slide, 100% in Oregon and Washington, with the exception of here in Oregon, the VA and the state psych are not reporting in. There is some progress on the state psych side. The federal VA system will take some time. But every other hospital is reporting in. Over 1,400 primary care behavioral health clinics are now connected in through PreManage, and over 30 health plans, ACOs, and health homes are also connected. Here in Oregon, I actually think this is in one of my upcoming slides. We have all the CCOs are connected, all the commercial plans are connected, other Medicaid plans like CareOregon's connected. So pretty good coverage here in Oregon. This is just a picture of their network, again, just to visualize how Eddy and Pre Managed work together. I guess I could be using my pointer here. So the vendor is there, Collective Medical Technologies in the center circle. The hospitals connect in with their data, and then all the other players on the care continuum tap into the database. That's just a visual representation. This is their vision of building this out. This kind of goes to Meryl's last point about getting everybody on the team connected around the patient. And so their tools do really allow this real-time collaboration. As we've talked, they have at the top there, urgent and emergent care connected. Primary care is getting connected. Behavioral health is fairly well connected. We're bringing on post-acute is starting. So they really hope to fill in all these circles around the patient so that you could see over time the true picture of the patient's care. Okay. So where are we in Oregon? Just a few more specifics there. We're about 4 years into this work. In 2014, Eddy was launched with the hospitals as a collaborative effort of the Oregon Health Leadership Council, Oregon Health Authority, the Hospital and Health System Association, and the vendor. In about 15 months, all 60 hospitals were connected, which was really quick progress, with the exception of VA and state psych. In mid-2015 then, the pre-managed work began with the CCOs and health plans adopting first. We have, like I said, all the CCOs are connected to pre-manage and good health plan coverage, and CareOregon was one of the first health plan CCOs to go live. In 2016, 2017, the adoption started to spread throughout Oregon with clinics coming on, both behavioral health and primary, and Unity Hospital turned on live, which was a really good piece of information to come into the system when they came live in 2017. In 2018, where we are now, work is really just continuing to fill out the care continuum we have now over 500 entities are live or are onboarding with PreManage. That's from both the health plan, CCO, clinic level. That's just across the entire state. And Sniff is starting to onboard, which is really exciting. Little bit more, we can probably jump through this, but you'll hear things like, oh, I got an Eddy, I have an Eddy on a patient. What is an Eddy? This is what it actually looks like. It really is a notification about a patient of critical pieces of information that can be delivered in different ways. Email and text, it can be faxed or printed or integrated into EMRs. And it really is kind of a patient profile of critical information that is supposed to guide the ED providers around the patient's care in that setting. We'll talk more about that in a minute. And then what is PreManage? Again, they're driven off the same database, but they look and work a little bit differently. So this is kind of what PreManage looks like if you were to log into the web-based version. And it, again, delivers that hospital utilization information and bits of clinical information in different ways, either through the features listed here, cohorts, which are lists of patients based on user-defined criteria, often around risk. Census-type data, reports, groups, notifications, and through the list. You'll hear a lot about pre-manage alerts or notifications. Those can be delivered in real time to sort of care managers and others. Those are just some feature stuff if you weren't familiar, but it sounds like most of the folks in the room are fairly familiar, so that's great. So where are we with Sniffs? So Eddy and Pre Managed are now expanding to Sniff. The vendor's very interested and motivated to engage the post-acute partners onto their platform. So they are actively onboarding Marquee. Here in Oregon, there's supposed to be 5 pre-managed pilot sites coming live really any day because the test data has been flowing for a while. So you might just see it pop up. That tends to be how we find about it. Prestige Care is also really close, right? They've been sending test data. It's getting validated with the vendor. And the plan is that you would see, and I'll show you some screenshots in a minute, Prestige's daily census data for all Washington and Oregon sites into Pre-Manage or via Eddy if you're an Eddy user. And as Meryl said, we're working together on kind of a pilot effort about once all this data comes live, how do we all work together? So this is kind of the vendor's high-level workflow or sort of value proposition, they would say, and what getting the Sniffs connected to their platform could do in terms of assisting with transfers of care and risk, really, of 30-day readmission. So just to look at this a piece, there we go. So if you can, so we'll spend a moment here just kind of looking at this. And actually, Meryl and the pilot team already has some other ideas about additional things that can be leveraged through this coming live. But if the patient starts in the acute hospital setting, there we go, and they're transferred to a Sniff, once the Sniff accepts that patient and admits them into their system, that starts the flow of data immediately, within seconds. So all of a sudden, the Sniff now, the Prestige folks, would receive any patient guideline information or brief history information about that patient once they admit them, which already starts to kind of close the data gap for the folks at Prestige. Everyone connected to Pre-Manage who has an association with that member, so their health plan, their primary care clinic, anyone else, would also see that information flowing into Pre-Manage, or could even be triggering alerts if they set up their platform to trigger on any Sniff admissions. Their care team can now say, oh, we just had 5 patients admit in the last couple days to Prestige Menlo Park. So any entity with a relationship with that specific patient based on they're enrolled with them, they happen to be their primary care provider or their behavioral health clinic, would receive real-time information about patients as they're admitted to a Sniff. So that would be the flow of information, kind of this circle with Pre-Manage starting to send information about those admissions to anyone with an active relationship with that patient. So then the patient receives care. They might be discharged, say after a 20-day stay, to home. They might, unfortunately, have an unexpected ED visit. What happens at that point of admission in the ED then is that also triggers more information flow. Then the Sniff back at Menlo Park, they receive an alert. Your patient who just discharged a few days ago just came back to the ED. That can trigger a set of workflow, outreach, and engagement tasks from Prestige to activate those teams to perhaps either, connect with the ED Bay phone, go on site, whatever may happen. That also would send an alert to other teams working with that patient, maybe during that safe discharge planning stage, to see an alert that this patient actually just is now at the ED, something needs to happen. They may go back to the Sniff. They may end up staying at the ED and admitting. But every person connected to the patient, so here the PCP is being notified as well, that the patient is either at the ED or went back then to Sniff. So if say, Menlo Park is successful right here with all members of the care team to get the patient actually from the ED setting back into a Sniff, everyone would then say, oh, they actually did go back to inpatient. We got them back into the skilled nursing facility for more follow-up care. or they go back inpatient. So that's kind of the different ways the information can flow and how different members can receive that information. I'm sorry, different users can see that information about the patient at different times. Any questions right here? No? Okay. This is kind of what it would look like. This is a demo data. There's no PHI here. But if you are pre-managed users, this should look pretty familiar. This is kind of the patient record view. So this is a fictitious patient and their demographics and their care providers. And down in this box, I know it's kind of small, but it's their utilization history. And so here you're seeing they had visits in a hospital setting. And here in this red box here is you will now see a skilled nursing admission, just like you would see a hospital admission. So you'd be able to see what happened in real time. And again, this data is sent as soon as they're admitted. It's connected to the billing systems, so the data comes very quickly into pre-manage. So you see within seconds, minutes, that the patient admitted and can trigger a number of care coordination and outreach workflows. I think that's it. Questions? Yeah.
Since it's connected to the billing system and in real time, can it upload claims data for prescriptions into PreManage?
They don't, no.
Okay.
PreManage at this time doesn't have any claims data. We are working, I see a member of our pharmacy back there. Our pharmacy team is very interested in getting some claims history into PreManage to kind of fill out this patient box and quite frankly, fill it out somewhere right there with a 30-day, Kristen, or 120-day history. 120-day history of paid prescription claims. And the vendor's very interested in that, so we're actively kind of piloting that work with them, so it could be something you see down the road.
How awesome will that be?
It'd be very
Pretty
awesome.
amazing.
Yeah.
The state sends some high-risk med,
Yes.
right?
The state does send some high-risk medications which are flagged. Yep. Actually, thanks, Summer. They flag them right here in what's kind of called a security event. That's not the best name, but they will flag like anticoagulants that the patient's on. That's a pretty small, obviously piece of the meds, but they're starting down that path because the vendor knows and they've been pushed by all their users to say, we really need some medication information in here.
Give it up for Liz, okay?